Hello, beautiful people. I'm so excited to have you here again for another news report. Immediately after this news report, run a comment on it, okay? So stay tuned. Buhari, why Nigerians seek medical care abroad? President Muhammadu Buhari has named the poor attitude of health workers across Nigeria as a main reason for the growing culture of Nigerians seeking medical care outside the country. The president stated this Tuesday at the second National Health Summit of the Nigerian Medical Association (NMA) and the 25th Triennial Conference of the Commonwealth Medical Association (CMA). The summit is being held between November 4 and November 8 in Abuja. Mr. Buhari, who is currently in the UK for a 2-week private visit, was the special guest billed to declare the event open. He was represented by the Health Minister, Osage Ehabe. Superintendent broken system. The minister said many Nigerians have lost confidence in the country's health system because of the poor service delivery in Nigerian hospitals. If we must be honest to ourselves, we must admit that even more than equipment and medical technical expertise, poor housekeeping and sanitation, and often poor and disrespectful attitude of the health worker, and also a perceived lack of confidentiality are damaging the image and reputation of the health system and also the public confidence in it, the official explained. There is no doubt that this loss of confidence in hospitals is the fact of medical tourism, he noted. The minister said only a change of mindset can reverse the trend. Medical tourism. Why is Nigeria losing billions of naira to medical tourism? Asked former Nigerian head of state Yakubu Gowon in his opening remark as the chairman of the summit. Thousands of Nigerians travel abroad each year to seek medical treatment as the nation's healthcare system remains dogged with multiple challenges. Former Minister of Health Onyebuchi in 2017 estimated Nigeria was losing 175 billion naira to medical tourism. Wow, this is mind-blowing, and every time we keep on seeing our president traveling to the United Kingdom for private visits, cases we all have now known that it is for medical reasons, and ministers are coming to say. In fact, when I saw the Minister of Health talking about some of the challenges in the fight of tourism, I was thinking he wanted to the father of medical tourism, I was thinking he wanted to mention Buhari, because the president sincerely is the father of medical tourism. He never stays a country. There is no doctor that we have ever known, or probably it's just for personal reasons, because it's everything that will be exposed to the public like that. There is no hospital that has ever been bored since he has attained that office. Even before he attained being the president of the country, he has always been traveling to the UK, right from before he became a newly democratic president. Because we've had instances, in fact, during the election campaign period, he had to travel to the United Kingdom. So President Muhammadu Buhari, I thought he wanted to say he's the father of medical tourism. Okay, yeah, there are so many challenges really that we're facing in the health care system here in Nigeria, and to say that the government has a major role to play in this, because we can easily point fingers to say the attitude of the workers. We can easily point fingers to say that there is some problem with sanitation and keeping the two clean. We can keep pointing fingers to talk about all of this, even confidentiality. We can talk about all of these things because it's so easy to point fingers at who when things are not going right. But I thought we will be talking about the impact of the Ministry of Education in putting things in place. How more government investing in trying to put a structure on this. We thought that the present government is going to do something. 4 years is gone. There is no blueprint on how they want to revitalize the healthcare system. And the healthcare system keeps going down. It was down before the government, before the APC government took over. It was still going deep down, and nothing has been done. You could imagine a common accident that the president's son, Muhammadu Buhari's son, had. So as a motorbike accident, it was flown out of Nigeria to, I can't remember the place, but of Nigeria. Imagine, what about people that have serious accidents here in Nigeria? Where do they go to? They go to the public health service, who in most cases are not able to save the lives of these common people. Of them, all of the elites travel abroad. Of the politicians, they go abroad for medical treatment. Are we talking about the amount that all the politicians spent in 2017, the 175 billion naira, or talking of the ordinary Nigerians spent in traveling abroad to places like India, to places like the UK? Because if you are to calculate the amount that politicians, starting from the presidency to even the local, because even as low as the local government, they don't use the public hospital in Nigeria. It is so sad. It is so saddening, sincerely. Like they all travel abroad. So who are the people that have been spending this, that spent these 105 billion naira? Because I know that if the president is traveling, it travels with entourage. And this is spending money. And all of the places that they go for treatment, they are not sitting, so they in hard currency. Here now we're talking of 107 billion naira, but this, when you go out, they pay in hard currency. So I think the problem that to be mentioned, what are the structures that the Ministry of Education is trying to put in place to make sure that some of these challenges, because we need to really face the fact and deal with it right from the root source, and not to come out and start pointing fingers as that we always do, or in the past, like pointing fingers to that the youth are lazy and all. We've all come that level. We've all come past stage where we keep pointing fingers to the masses. You keep on pointing fingers. The other time we heard of government to import healthcare workers. We have enough Nigeria and running out of the country, because they will be well paid outside. You can imagine medical personnel that is earning little less than 500,000 a year. If he goes to work somewhere in Saudi Arabia, it gets paid nothing less than 3 times of that amount, and they are working effectively. The whole system is them to work effectively. They may work their ass off because they know that they will pay times 3. Is it not the same people that they will go there, work there 1 year, and come back here and still collect their stipend immediately? Some of them have even refused to come back, and they go outside of this country, they work ass off, and they get money for it. So I think the federal government needs to look at structures in terms of the remuneration of what is the pay of personnel. Are you paying them enough? Is it what they are doing? Are you investing in the structures to make sure that things are in place? Not just like you are not investing and you are heading to come out of it. It is not anywhere. Even the places they go, they could tourism. That's why they could maintain that much standard. So we need funds. We need funds to be able to maintain standard. Forget about it. Nigerians can maintain good attitude. They can maintain good sanitary conditions in the hospital, if it is well funded, all these other things will be taken care of. It is not really an attitude of a thing in terms of like that is how our culture is, not at all. It is an attitude that is showing that they are not well paid, that nobody is taking care of them. What of the insurance policy for them? Where are their children going to school? Are they going to good schools? What is the hope for their children, the future of their children? So these things are not put in place. So we can't really come up and start saying when you are not paying someone very well, the children, the hope for their future is so slim, and you are expecting them to put in their very best. Oh no, oh no. I think we really need to have a rethink on all of this before we can start pointing fingers to people. Okay, so that's my own take. I would like to see your own opinion in the comment section. Thank you for watching. Thank you for watching. See you some other time. Bye bye.